There's a misconception that community oncologists are oncologists gone wild, that they basically just prescribe all sorts of things that have no scientific foundation, and that it's costing us a lot of money because they are so loose with their prescription pens. The problem is the data doesn't support that idea. When you actually look at the literature regarding compliance to national guidelines, what you find, statistically speaking, are very high levels of compliance. Practices are already managing very expensive drugs, taking into account patients' copay, their deductibles, the overall cost of care, and they're delivering a product that is highly effective and is cost effective. When you look at the high rates of compliance to national guidelines, what you find is a very modest effect size. So much so that when you move a practice in some portion of their patients from off pathway to on pathway, you have a surprisingly small effect on the overall cost of care. Stated differently, this is actually evidence for the value of the current oncology practice pattern. Oncology attracts so much attention because of the exponential growth in the cost of cancer care over the past several years. This is because a tremendous number of new branded products have entered the marketplace. It's because we're identifying patients earlier, and it's because patients we're treating are living longer. So it's not surprising that cost of cancer care would increase even exponentially over the past few years. It's a valid question to ask, will the cost of cancer care continue to grow without limit? Well, it is true that there are going to be more cancer survivors. The predictions are that there will be more patients alive to receive adjuvant care, first-line care, third-line care, even late-line care by the year 2020. In fact, about a 31% increase in the number of cancer patients available for treatment. It's also true that there are going to be new and expensive cancer treatments. In fact, the drug development pipeline is full of cancer products. And so of the some 800 products in development, some fraction will make it to the market, and they will be relatively expensive. However, when you look at the most recent studies projecting the cost of cancer care, it's very interesting that you find that while the population will grow by some 31% during the next decade, the cost of cancer care, if it follows the current pattern, will only increase by 27%. This is because over the next decade, a large number of the treatments in the oncology portfolio will go generic or will have a biosimilar equivalent. And so you have a situation where over the next decade, and a whole nother layer of value will come into the marketplace, making it harder for new treatments to enter the market without a substantial, compelling clinical argument for its inclusion, and making it harder to price that drug without considering the lower cost alternatives. So over the next decade, we're going to see this marketplace take another leap forward. We're already delivering accessible, high quality, cost-effective care, and we're only going to see that value quotient move higher in the future. A fundamental problem in healthcare has to do with the aging population, the increasing number of people who require extensive and chronic medical care, and the relatively fewer number of people who are available to pay for that care in younger age cohorts. So as we try to get hold of an ever-increasing healthcare spend, we begin to look at areas that are growing more rapidly than others. And oncology tends to be one of the top 5 drivers in terms of growth rate in the healthcare spend. community oncologists deliver well over 80% of all of oncology. So it's only natural that as people try to get a handle on the growth of cancer care expenses, that they would look at the people who are writing the most prescriptions and are managing most of that spend. It's community oncology. Unfortunately, within that competition for the limited healthcare dollars, the community oncologists are the least unified, they have the least concentrated voice, and they're the least able to really advocate for themselves. It is ironic that there is so much negative attention around community oncology. I think this is for two reasons. One, a misunderstanding of the market trends and where the market is going. And two, because community oncologists are really the weakest among a number of competitors for limited healthcare dollars. Unfortunately, only recently have we begun to produce data that demonstrates the value community oncology has brought to the overall cost equation for cancer care. We've needed to tell that story, and now we need to educate folks so that they understand that the dollars we're spending are worth it, that we're saving lives and we're making the quality of life better for people who are experiencing a horrible disease. Within that, we also need to take the emerging data and educate them on where oncology care is going, how that the maturing portfolio will produce even higher levels of cost effectiveness and value. The conclusion being that while we may want to improve cancer care, we need to make sure we preserve the value that we already have.